By this time, you have completed our BK education course, tested the process on a patient or two, and have gotten a taste for the benefits of adjustability. Now it's time to expand your knowledge into the AK realm. We will help you test your skills and apply the benefits of RevoFit to your AK patients. Many of your AK patients are active. Well, maybe most of us wouldn't consider stepping on and off a curb active, but for patients like Aaron Murray, every move they make is a calculation, even a risk. Good socket fit is the key to good function, comfort, and confidence in every activity. In above-knee amputees, the need for secure fit is magnified due to the complexities of controlling not only the ankle and the foot, but the knee as well. For your AK patients, socket fit is everything. But how can a prosthetist deliver consistent fit and manage positioning when limbs are constantly changing? We all know that sockets fit differently in the morning than they do in the evening. In fact, clinical research at the University of Washington has measured different limb volume readings between morning and afternoon, and from day to day. They cite volume changes as one of the biggest factors affecting interface stress between a socket and a limb. And we all know that patient compliance with sock management is seriously hindered by having to drop your pants to take on and off socks over and over every day. That's where RevoFit adjustability comes in. The micro-adjustability of the movable panels allows patients to adjust the compression within their sockets whenever they want to. Fit can be adjusted in response to changes in the body and changes in activities. Adjustability allows patients to ride a bike or a motorcycle, knowing their leg is not going to fall off. For our curb-hopping AK patient, Aaron Murray, adjustability allows for weekend getaways with the family.
Like, I go up in the mountains quite a bit. We got a motorhome, we go up in the mountains quite a bit, and going from Salt Lake to the mountains is a big deal. And a lot of people don't realize the elevation change difference and the pressure difference it has on your socket. Going up to the mountains, when you have a socket that's meant to fit you in the valley, sorry, you get sores because it doesn't fit you when you get in the mountains. You want to leave it on all the time type of thing, because once you take it off, you know it's just not going to fit. With this, it just doesn't matter. You just don't tighten as much. I mean, that's it. And if you go to California, it's lower, you tighten it more. It's just really nice. It's nice to be able to do that.
As a matter of fact, if you ask RevoFit patients, most will tell you that after having a RevoFit socket, they will not go back to a rigid socket, no matter what. This is because patients' lives are truly changed by having adjustability.
For me, it just fits into my lifestyle. I'm not trying to fit into it.
Patients aren't the only ones loving adjustability. Practitioners like you are discovering that adjustability means fewer office visits, fewer socket remakes, and more time seeing new, billable patients. And that will change how you practice. For Joe Mahon, inventor of RevoFit, adjustability has significantly improved his bottom line and his ability to expand the geographic region from which he can effectively treat patients. For my patients using RevoFit, I typically see them only for their yearly visit. Most of their fit issues they handle themselves. This frees me up to expand my business and treat patients in multiple states. A practitioner in Texas, Tom Letourneau, told us he is putting about 80% of his patients in RevoFit. With RevoFit, I don't have to work so hard. Patients can adjust their own fit, and that saves time and ultimately money. It's one of the best insurance policies you can get. We know that learning to fabricate an AK RevoFit socket takes time, and it takes practice. But if you ask these same prosthetists and their techs, they will tell you it's totally worth it. As Nick Gamble in Nashville put it, fabrication does take extra time, but you have to look past that to the end result. In the end, these sockets just don't come back for remakes. It's just better. With all this in mind, it's time to consider ideal patient candidates that you will see in the coming weeks. It's possible that the next AK patient who walks into your office would be ideal for a RevoFit socket. But at this point, we urge you to remember that it's best to start with an experienced amputee with a good attitude and someone who has a relatively straightforward indication. Lastly, focus on a patient who struggles with distal lateral femur pressure, rotation issues, non-compliance with proper sock management, or seated comfort issues. These indications can be significantly improved with RevoFit and are a great place to start. In the process, we can ensure that all the hard work you put towards making a great overall AK prosthesis is not frustrated by ever-changing fit problems within the socket. With adjustability, the patient can adjust the prosthesis to their life, making it work better for them more often. It's a tool that gives you ample insurance that your work will be well adopted and will lead to great patient outcomes. Your patients are adjusting every day. It's time to give them an AK socket that does too. It's time for RevoFit.